Hello listeners, welcome to Views on Health. With me on the program tonight is Dr. Bimantha Perera, consultant ENT surgeon, University Hospital at the Kotalavala Defense University. Tonight the topic is head and neck lumps. Interesting indeed, Doctor. Over to you to introduce this topic of head and neck lumps.
It's a pleasure to be back. What's so wrong about a head and a neck lump? The problem is, obviously, anyone gets afraid if there is a lump in your body. Why? Because we think, oh goodness, is this a cancer? But do not forget, majority of your lumps are not cancerous. They are benign lesions. So we do need to just go step by step, but I think it's good that people have that fear, that when there is a lump, that they need to get medical assistance. Because I think I'll just tell my whole take-home message now. If you do have a lump, you need to get some medical assistance rather than sit and wait on it. Because most of these things can be preventable if contacted with a medical professional early. So what's wrong about it? As I told, it can be benign or it can be an early cancer. So what in the head and neck region, that's where from ENT, the commonest problems are the thyroid. We also have your salivary glands, where the parotids, the submandibular glands, and then obviously the lymph nodes. Right? And the more rarer ones are also there, like thyroglossal cysts, branchial cysts, or many other rare causes. Okay. Let's talk about the lymph nodes. I think that is where most people are scared. We get a lot of children, we get a lot of adults with this problem. They oh, I have a neck lump. Doctor, what can you do about it? So obviously when you do come to us, we obviously take a history and see whether you have any change of voice, any difficulty in breathing or swallowing again. Do you have any problems in your mouth, your ears, or your nose? And then we do examine you. And when we touch a lump, we get a lot of information. Is this a cystic lump filled with fluid, or is it actually a hard solid lump, or a very soft solid lump, or medium paste, or is it attached to anything underlying? These are all things that give us some clues. Oh, is this a normal one, or is it something that we should be worried about? Okay, so the lymph nodes play a major role, because what are lymph nodes? Basically, they are the part of your immune system, kind of like the police stations in your body. So if an infection comes, it drains the facial area, the neck area, and if there's an infection in this area, your lymph nodes will get enlarged. So in children, that's the commonest cause. Even in adults, that's the commonest cause. And especially it's seen in children when they get a simple common cold. They can get infections like this. Infections in the ear can cause lymph nodes. Infection in the scalp, a lot of dandruff can cause lymph nodes to just swell up. And they are generally benign. When you touch them, they are not very painful. They're just like, tiny, not too big. So then we just reassure them. But how do we exactly know? We always get a scan done, and we do some investigations as well, but the scan actually tells us a lot of information, and the scan is very, very good at picking up if there is something sinister, and if it is so, they do not hesitate to say so. So the lymph nodes are also an area where a cancer can drain. So a cancer can drain and deposit its cancer cells. So if those lymph nodes get big, those are cancerous. And they, again, may be the first clue that you actually have a cancer in the throat. That is why it is important to come and get it sorted out, to get it evaluated. if we do have any doubt, we generally do what we call an FNAC, a fine needle aspiration. We don't do it. We get the help of a radiologist to do an ultrasound scan and get the sample, and the pathologist would give their interpretation as to what it is. Now, in the head and neck region, we obviously have cancers of the throat, the nose, the tongue, the tonsils, and all these regions. And most of these will present with lymph nodes to the neck. I didn't mention, the thyroid as well. Okay? So the problem here is, apart from these, you also can get lymphomas, where there is no real cancer in the throat, but it's just a lymphoma where the cancer cells are within the lymph nodes. And again, the first presentation may be this, and you have treatment for these. So that's why it's important that we address these things early rather than just wait for months and months. Now, shall we go to the parotids, because that's again another common area. It's not as common as the thyroid. That's why I'm going to talk about that at the end. So parotid gland and the submandibular gland are two major glands which gives our mucus. So it's important that we have these glands, and it helps in digestion, it helps in maintaining our dental hygiene, and so on and so forth. And it also helps in immunity as well. So the parotid glands also suddenly can get blocked. If there is a tiny stone, it can cause a severe retention of mucus and cause a parotitis. And sometimes an infection like mumps can cause the parotid gland to swell, and people do get worried about it. Similarly, there can be lumps which may be benign. They are called pleomorphic adenomas. So those need surgery. So they need evaluation, and they need surgery, and they need to be removed because they can potentially turn malignant later on. And then rarely you have the malignancies. Similarly, the stones in your submandibular gland, quite common, and people, how they present is, oh doctor, when I'm eating, my neck swells up and it's painful. And we sometimes just open the mouth and see a stone at its opening, or the stone can be actually blocked somewhere else. So depending on those, we can do various treatments.
What is the stone that you're referring to?
So it's basically concretions of your saliva due to an infection or some sort of an infective nidus.
It becomes a hard lump.
It becomes a hard little stone,
more
yes,
than a lump.
So you've heard of kidney stones, all those. It's just like that. Yes,
it's a deposit.
It's a deposit, but they're very tiny. But even if they're tiny, they can cause a lot of trouble.
And one would feel it.
Yes, some would feel it. Some may just feel it only as a swelling of the gland.
So would the feeling be? Can there be pain, or can it be an irritation?
So some may have pain, some may not have pain. That's a difficulty. So if it's partially blocked, they may not have much pain at all. It's only the swelling that comes when they are eating. So if they have a tasty meal, it's going to swell a little more than a bland meal. Again, one thing we can do to avoid this is drinking plenty of water, which again I think is a good public message to give. Drink plenty of water, and that'll help in the hygiene as well.
How much is plenty of water for an adult?
So it depends, obviously, but at least 2 to 3 liters a day.
A day?
Yes, but it depends, because if you are a patient who has kidney diseases and things, you do need to restrict. So yes, 2 to 3 liters. Do not forget the hot weather. We have to compensate for that as well. Yes, especially these problems are again seen in older people, because with age your salivary glands don't function very well. So there can be some stasis of saliva inside, and that also can cause problems. Then infections can cause problems, and that's the time, if they get recurrent infections, we may actually have to remove the glands.
Yes, doctor. Interesting. Would you continue to talk about the thyroid?
So yes, now thyroid, I'm sure most of you have come across a person with a thyroid at least once in your life. So it was rather a common thing to see large goiters in ladies, in the yonder years, but now it's relatively getting rarer and rarer because we are obviously treating them. Now, this was very common those days, especially in the hill country, because goiters were classically associated with iodine deficiency. But since of late we have rules and regulations, and all our salt is iodized. So now we've seen the incidence of it coming down. But still, classically, you do see occasionally large multinodular goiters. So again, ladies or females have a higher tendency for thyroid problems, but the good thing is majority of them are benign. And rarely there can be malignancies. I'm not saying no, but it's very rare. But in the males, their incidence of thyroid disorders are less. But even if they get a thyroid disorder, we do investigate because they have a slightly higher chance of malignancy than the females. So sometimes they may say there's a lump in the throat where it's compressing, or it's again causing a globus sensation or irritation. Some may complain that they can't swallow because of the pressure symptoms, and then we do an ultrasound scan. Now in the ultrasound scan, we can very reliably tell whether this is a normal one or not. And if there are multiple nodules, we call it a multinodular goiter. Sometimes you'll see a single nodule. Then we treat it accordingly. Usually, if there is any suspicion in the scan, we go for a needle biopsy, and if that again says it's suspicious or cancerous thing, we go for surgery. But apart from that, something that's very common in the teen girls is they have a physiological goiter. So we see mothers bringing their teen girls to us and telling, "Oh doctor, the neck has got a little big." So we actually do a scan just to confirm or relieve their anxiety. But when we feel it, we know it's actually not. That's just due to puberty. So, but parents are quite worried because at such a young age, why are we getting this? Then sometimes it can be the thyroid gland function can be deranged, and when the thyroid gland function deranges also, these problems can come. We call it thyroiditis sometimes, where there's a little inflammation of the gland. So you can get a little increased thyroxine in your body, which makes you kind of sweat a lot, irritable, lose weight, eat a lot. So it's totally opposite of what you would expect, which is relatively rare. But the more common one is the hypothyroidism, where people start gaining weight, they're very lethargic, they may even have a little hair loss and quite dry skin. So these are things we can actually identify and treat. And they may be along with your thyroid lumps as well. So we do assess all these things when it comes. Now, just come into a little bit of technical details because I think people would like to hear this. Cancers of the thyroid. Now, this is one place I would like to say that there are a few types of cancers, different types of thyroid cancers. One is called a papillary, one is called a follicular, medullary, or anaplastic. So the commonest cause is papillary carcinoma, which when we want to comfort the patient, we say that's probably the best you can get. Why? If we identify them early, all we need to do is remove the thyroid gland and may or may not even need any further medication. So that is simple as that. and the recurrence rates are very, very low. Unfortunately, anaplastic carcinoma is not the best to get, but it is very, very rare, and it's mainly seen in the elderly, and generally there is really nothing much we can help too much with. But apart from that, thyroid cancers can be very well managed. People do have that fear for thyroid cancers, but we can manage them very successfully in today's day and age.
So, when you talk of the thyroid cancers, and you have treated, and the chances of it spreading to anything else?
Yes, so papillary cancers rarely can spread. Again, can go to the lymph nodes, even all these different cancers. We have papillary, follicular and medullary. Some can go far off, some can even go up to the brain and deposit even in the skull and bones, but these are very, very rare. Very, very rare. That's a fortunate part of thyroid cancers. If you can detect them early, we can treat them very, very successfully.
So would you mind going back to the signs and symptoms?
Yes. So again, if you do feel a neck lump, you do need to come and see a doctor. And probably the doctors will request a scan, and yes, you should discuss with your doctor, okay, if we are going to remove the gland, what are the problems and so on. That should be a good, healthy discussion you should have with your physician or surgeon. And what are the complications of these problems? What are the side effects of the drugs that we give? Because if you have low thyroid, we give thyroxine. If you have high thyroid, we give other drugs. These are things I think you as the listeners also should ask the doctors, because thyroid surgery is probably one of the commonest surgeries we perform by the ENT surgeons and the general surgeons as well. So I think one should be aware of what problems can happen, because when we do thyroid surgeries, there is a risk of damaging two little nerves which just go behind the thyroid. And if you damage one of them, you will get a hoarse voice. So that probably we can manage, but if you cut both nerves, you can have something called stridor, where you cannot breathe, which is quite deadly. So it's a very rare complication, very, very rare complication. But the surgeons are trained to identify this nerve and preserve it. But in cancer, sometimes we may have to sacrifice. But otherwise, it's a generally safe surgery that one should not worry too much.
And once the surgery is done, the chances of it recurring, I did ask whether it can spread, but also the chances of it recurring are also minimal. So what we do is, once a surgery is done, we evaluate that histologically, and if we think that there is a chance of recurrence, we generally do further chemo. It's not correct to use the word chemotherapy. It is a type of chemotherapy, yes. We actually can treat it with iodine, radioactive iodine, which is done at the Maharagama Apeksha Hospital. And that's quite effective. And very rarely they may give other chemotherapeutic agents as well, especially for the anaplastic cancer. Yes, so it can be prevented quite a lot. If you get a recurrence, we may have to go in and remove the lymph nodes or whatever that's causing it. Very technical, so I'm not going into the details of it, but yes, we can treat it still. But the prognosis, overall prognosis, is very good. That's the take-home message. In the case of it recurring in some way, I know that it's not a fair question, because one cannot put a time frame. But is there a general time frame within which we might find a patient coming back because the problem has...
No, it's a little difficult to tell that. But what I can say is that statistically, a patient with a papillary carcinoma has over a 95% chance of not having a recurrence over the next 5 years. So that's almost like getting cured.
Right. So and there's something sort of encouraging, isn't it?
Yes. And that is the commonest cancer as well. That's why I said when patients get very upset, I said, you should be happy for getting this cancer because this is something we can help you with.
Help you with, yes. Treat and help you with. Right, thank you, Doctor. So time has caught up with us. You already given us a take-home message.
Yes.
Would you mind repeating it?
Repeating that is, I think, important. If you do feel a neck lump, please visit your GP or doctor and get some medical advice.
I just to clarify that a little further. When the lump is there, I mean, at some point it begins to show, or you begin to feel. It can be painful. It may not be painful.
It may not be painful. That's a problem.
Both sides. Yes.
Both.
And it can be on any part of the neck. Right or left, or in the front, wherever.
Actually, I would say, to be fair, in the entire medical profession, if you do have a lump in your body, do get it evaluated for that matter.
Not just the neck.
Not only the neck.
Right. Yes. Thank you, Doctor. So on that note of solid advice, we end this interesting discussion on head and neck lumps. Thank you so much to you, Dr. Bimantha Perera, consultant ENT surgeon, University Hospital at the Kotalabala Defense University, for being with us on the program and sharing your valuable expertise with our listeners on this important topic. Thank you, Doctor.
Thank you.
Thank you to Manjula Mahesh for technical assistance. I'm Fatima Razi Kada saying good night, and hoping to catch you next Monday same time on Views on Health.